Hi, I would like to present before you a presentation prepared by Dr. Sunil Diliwal. He is consultant pain and palliative care, Mumbai. He is also the secretary of the Maharashtra State Chapter of National Association of Palliative Care for AYUSH and Integration. He presents before you the palliative care management and role of AYUSH, an evidence-based approach. Marcia Angel, in an editorial published in the New England Journal of Medicine in 1998, stated, "There cannot be two kinds of medicine, conventional and alternative. There is only one medicine that has been adequately tested and medicine that has not, medicine that works and medicine that may or may not work. Once a treatment has been tested rigorously, it no longer matters whether it was considered alternative at the outset." Fontana Rosa in the same year published an article in the Journal of American Medical Association titled "Alternative Medicine Meets Science," where the author states, "Whether a therapeutic practice is Eastern or Western, is conventional or mainstream, or involves mind-body techniques or molecular genetics is largely irrelevant, except for the historical purposes and cultural interests. As believers in science and evidence, we must focus on fundamental issues, namely the patient, the target disease or condition, the proposed or practiced treatment, and the need for convincing data on the safety and therapeutic efficacy." Problem areas in oncology where AYUSH has a role. Difficult symptoms may be there. We have to maintain the quality of life, the disease management, how we do the management of the disease and what are the complications. Difficult symptoms relate to fatigue, anorexia, constipation, dry mouth. Quality of life indicates physical well-being and emotional well-being. Disease management, malignant wounds, reducing treatment side effects, and complications, oral mucositis, CINV and counts. Fatigue and anorexia. Effect of ashwagandha on the development of chemotherapy induced fatigue and quality of life in breast cancer patients is vividly explained through a diagram. There was a mini review on curcumin, a polyphenol with molecular targets for cancer control, and how it has got improvement in fatigue and anorexia. Constipation. The evidence is managing morphine-induced constipation. The findings are herbal preparation, misarkasneham in small volume of drug, tolerable taste, once daily dosing, low cost, prophylaxis. An open label prospective clinical study in the management of functional constipation. Dry mouth. Efficacy of Rasayana Avaleha as adjuvant to radiotherapy and chemotherapy in reducing adverse effects. Significant improvement in xerostomia and taste. Oral mucositis. Evidence, herbs in oral mucositis. Findings, medicinal herbs help improve oral mucositis via anti-inflammatory, immunomodulatory, anti-toxic, antiseptic, sedative and wound healing effects. Management of radiation induced oral mucositis with an herbal mouthwash. Onset of mucositis was significantly delayed, analgesic requirement was low. Treatment interruptions and hospitalizations were also significantly low. Intolerance to food and dryness of mouth were significantly less. Oral mucositis continues. The evidence is honey in oral mucositis. Findings are significant reduction in grade 3 and 4 mucositis in patients receiving chemoradiation. Indian turmeric powder with honey. The findings are effective in reducing symptoms and complications. the World Health Organization's oral toxicity scale is properly diagrammatized in this presentation. Chemotherapy induced nausea, vomiting. The details are already explained. Counts. It is available in the Journal of Ayurveda and Integrative Medicine, June 2017. So, regarding physical well-being, what is the evidence? Combination of Ayurvedic drugs in improving physical well-being. The findings are reducing toxicity of treatment, improvement in quality of life, improvement in symptoms. Ashwagandha for improvement in physical well-being and quality of life. Findings are positive effect on fatigue, improvement in overall quality of life and improved survival. Emotional well-being. Evidence is Jerry 40 as an anti-stress agent in cancer. The findings are 1/3 of patients reported improvement in sleep, appetite, well-being, fatigability, interest in surroundings and anxiety. Pranic healing for the mental well-being, improvement in anxiety and emotional well-being. Malignant wounds. Original research, the effect of honey-coated bandages compared with silver-coated bandages on treatment of malignant wounds, a randomized study. 62% improvement in wound size, 58% wound cleanliness, the VAS score for malodor 0.007 and exudation 0.0001, improved significantly post intervention. Stoma and fistula. Historical perspectives in the care of patients with enterocutaneous fistula using Karaya powder for barrier dressing. Ayurveda and plant-based interventions for cancer management, a systematic review. The details are already available here. COCHRANE, complementary medicine, trusted evidence, informed decisions, better health. 137 COCHRANE reviews on alternative medical systems excluding yoga. Ayurvedic medicine 8, Eastern Asian traditional medicine 110, naturopathy 1, homeopathic medicine 15, other alternative 3. Ayurvedic medicine 8, cancer 0, Eastern Asian traditional medicine 110, cancer 10, naturopathy 1, cancer 0, homeopathic medicine 15, cancer 1, other alternatives 3, cancer 0. COCHRANE reviews based on complementary medicine, energy therapies 201, mind-body interventions 159, alternative medical system 137, manipulative and body-based methods 46, natural product-based therapies 654. Energy therapies 201, AYUSH in cancer 0, mind-body interventions 159, AYUSH in cancer 2, alternative medical system 137, AYUSH in cancer 1, manipulative and body-based methods 46, AYUSH in cancer 2, natural product based therapy 654, AYUSH in cancer 6. Conclusion and future recommendations. Integration of AYUSH in oncology palliative care patients is associated with good clinical outcomes. There is promising evidence published in AYUSH journals and literature to suggest effectiveness of AYUSH interventions in cancer care. AYUSH based interventions can play a vital holistic complementary role alongside treatment and palliation of patients with cancer. There is a need for conducting large multicentric experimental trials to establish this observation as empiric evidence. To combat cancer and combining traditional healthcare knowledge with conventional systems will make complete healthcare setup under one roof. Although several cancer centers today now have a palliative care program, significant gaps and interruptions in the delivery of care still remain. Integrative approach, the need of the hour. Thank you.